Today, we're talking all about pain management after birth, what's normal, what helps, and what to watch for.
So whether you had a vaginal delivery or a C-section, your body's gone through a lot, and managing your pain is key for recovery, rest, and bonding with your baby. Let's start with medications. Most moms will be prescribed a combination of ibuprofen and Tylenol after delivery, and the key is to take them around the clock and interchangeably.
Typically, that means ibuprofen 600 to 800 milligrams by mouth every 6 to 8 hours, and Tylenol 1,000 milligrams every 8 hours.
Right, so that means you'll get ibuprofen, and then 4 hours later, take your Tylenol. 4 hours after that, you'll get your next dose of ibuprofen. 4 hours after that, you'll get your Tylenol. So do you see how you're always taking something and around the clock?
And make sure to ask your nurse for these medications also.
It's really important to stay on top of your pain meds. Don't wait until your pain gets worse. Take them when they're due, because once the pain kicks in, it's much harder to manage with these pain medications because they take time to start working. So staying on schedule keeps you comfortable and helps you heal.
Now, let's talk about something a lot of moms aren't prepared for: cramping after delivery.
Yeah, your uterus is actually shrinking back to its normal size. Your uterus is about this big. It's got to go back to the size of a fist. So while you're breastfeeding, those cramps can get pretty intense.
They're totally normal. It might feel like period cramps, but it's a good sign. It means your uterus is contracting, and it actually helps decrease that bleeding. Now, if it's your first baby, you might not notice it that much, but if you've had multiple pregnancies, multiple babies, that cramping is going to definitely be more intense with each delivery that you have.
And here's where ibuprofen really helps. It reduces your inflammation, it eases those cramps, and can even help decrease your bleeding over time. So yes, it's doing double duty for you.
If you've had a C-section, your provider might also prescribe a stronger pain medication like Percocet, especially in those first few days, but just make sure that you're taking it as prescribed and you're tapering off when you're ready.
And a lot of moms, when they're taking Percocet and they're breastfeeding, they're concerned that it can transfer over to baby. So your liver is actually metabolizing that before it transfers it over to the baby, and only a small amount gets through your breast milk. So there's really not too much of a concern. You can still breastfeed while taking the Percocet. And if you had a vaginal delivery, you might feel sore, swollen, or tender, especially if you have stitches.
An ice pack is your best friend for those first 24 hours, along with using that peri bottle. It's that squirt bottle that you can use. It's best to fill it up with warm water and squirt it on your bottom as you're peeing. That will help alleviate any of that burning sensation that you might feel, because there's actually ammonia in your urine. So when it hits those stitches, that open wound, it tends to burn a little bit. Then you can switch to a sitz bath for ongoing comfort.
And your nurse will talk to you more about a sitz bath. But some of the products that I have here actually are some things that this you would have to purchase separately. They don't have this type of squirt bottle that actually squirts upwards, but they do have a squirt bottle that would be perfectly fine to squirt while you are urinating. Then they give you the ice pack pads. These are your best friend. Honestly, put them on all the time. You are going to feel so sore and so swollen. So best friends here. And then these underwear are disposable that they give you. Phenomenal. See if you could possibly take some home. Really, the pads that they give are these huge maxi pads. So what I usually recommend is they'll usually have Tux pads there. So with your Tux pads, just take multiple Tux pads and line them up on the pad. And then if necessary, sometimes they'll have hydrocortisone ointment. You can also get like a perineal healing foam. This is also something that's helpful, and you're just going to douse those Tux pads with that as well. You can literally do all of this also on the ice pack too. So you don't even really need, you could put the ice pack on top of the pad and then do everything on top of the ice pack. Again, this will be your best friend, and change it often.
Now, those tuck pads, they're actually medicated cooling pads, so they do feel cool to the touch. They have witch hazel in them.
Dermoplast is also a great spray. Not all hospitals have them, and if they don't, just bring it in your hospital bag just in case. That's another spray that you'll apply right after you go to the bathroom. That helps a lot with like healing and itching and irritation that you might feel. And so these really help soothe that area and promote healing. For our C-section moms, take it slow. Keep your incision clean and dry, and support your belly when you move or cough. So some things that will actually help with that is if you brace a pillow against your abdomen, and when you're coughing, just hold that pillow, because you do want to cough. That's going to be important. The other thing that I always say is, I'm going to stand up for this. When you get the belly band, you actually want to hold your belly up and then put the belly band underneath it. So you kind of feel like the belly band is more of like a shelf for support for your abdomen. that's going to help a lot with pain as well.
So I was a C-section myself. I can 100% confirm that that belly band was a lifesaver for me, especially getting in and out of bed, in and out of the chairs, walking around. It really does provide that extra support and makes a big difference. It provides that extra stability for you. The other thing is gas. So don't forget to take a Gas X pill. The other thing that you can also do is don't drink from straws when you're in the hospital, because drinking from straws, it's going to just add that extra gas into your belly. So just drink directly from the cups if you can. And the other thing you can do is chew gum also.
The other thing too that a lot of moms don't know is that, so your abdomen was just open, right? And now they're closing it. And so there's all this excess air inside. So that has to be absorbed by your tissues, but it also the pain refers up to your right shoulder. Sometimes moms it's the worst pain that they're experiencing. Sometimes moms actually will tell me, and I think I'm having a heart attack. You're not having a heart attack. It's just more so that pain. Again, the simethicone, walking around as soon as you can, that's going to help in the long run.
Okay, let's talk about something every mom dreads, that first bowel movement, that first poop.
Most providers will often prescribe Colace or Miralax. Take it as directed. Take it. Drink plenty of water to make things easier.
Hydration will help with everything also, your recovery, your milk supply, and your overall energy.
One of the best things you can do for pain and healing is get up and move. Even short walks around the room or the house make a huge difference. You're going to feel like you can't. You're going to feel like you really can't do it, but you can. And I promise you, once you actually start moving, you will feel so much better.
Moving helps prevent the blood clots too. Watch for redness, tenderness, one leg more swollen than the other, or sharp calf pain. If you notice any of those signs, call your provider right away.
Swelling is also super common, especially in your legs and your feet. So compression stockings, which the hospital has, so they should offer them to you. If not, ask them if they have them. But they can really help with circulation and bring that swelling down.
The other thing that can happen in the hospital too, if you are a C-section, in the hospital, they will also put these compression boots on your legs, because you are going to be on bed rest for about 6 hours after delivery if you're a C-section. And that will actually kind of provide a gentle massage to those legs to keep that blood flowing.
Yeah, because when you are postpartum, you are at the highest risk of getting a blood clot, also known as like a deep vein thrombosis, which puts you at risk for heart attack, stroke, pulmonary embolism, which is a blood clot in your lung, things like that. So we want to prevent that. So again, that's where the compression stockings come in, the compression boots come in, and the importance of ambulation. That's always key.
And please remember to rest. Your body just did something incredible and it needs time to heal.
Everyone wants to come see the baby, but don't be afraid to delegate. Ask visitors to bring food, coffee, tell them to wash their bottles, tell them to fold your laundry or help with cleaning while you rest and recover.
But not only that, don't be afraid to tell people no. Don't be afraid to tell them, no, don't come to the hospital to visit me. No, don't come to my house to visit me right away. Enjoy the time with your baby. You just have this new family and it's so new and precious, and you want to protect that. So don't feel bad for saying no to people.
Postpartum recovery takes time and every mom's journey is different. Give yourself grace. You're doing amazing.
And if you found this video helpful, hit that like button, subscribe, and share it with another new mom who could use these tips.
Thanks for watching the Postpartum Nurses.